Thank you for joining us today for today's virtual lunch and learn. Today we have Terri King, Office Manager of Gilbert Ironwood Office. I will now pass it over to Terri King for her presentation on what every new patient at Ironwood should know.
Thank you for joining us today. We're going to talk about just a quick review of what you should know as a new patient at Ironwood Cancer and Research Centers. Is the slide show? We have a little PowerPoint presentation just to go over just some of the steps and things you might want to know if you're coming into Ironwood as a new patient if you've never been here before. So what are the reasons you might be coming to Ironwood Cancer and Research Centers? It could be that you received a referral from a specialist that you have been to, or maybe your primary care physician. They had maybe some concerning results on a test that came back, and they'd like you to see a hematologist or an oncologist. It could be that you were in the hospital, you were inpatient at the hospital, and one of our hematologists or oncologists were called in for a consultation to see you while you were in the hospital. So normally you would come and see that physician in the office as a follow-up. Another reason you might come to Ironwood is you're already seeing a hematologist or an oncologist and you'd like to have a second opinion. So you let us know at that time. The first steps is we have a scheduling department that's separate from our offices. It's strictly for new patients. So when they get a referral when they receive a referral from your physician, or if you call in and ask, say, hey, my physician gave me your number, the scheduler will work with you to gather all the information needed for your initial consultation. Please plan 15 to 20 minutes on the phone with that scheduler as they gather information about why you're coming in and your insurance information, etc. And we'll want you to have that information ready. We'll have a list of them on the next slide here. So some of the information needed to make your first appointment is we need your name as it's listed on your insurance card. This is really important because all of our claims that go to your insurance company are filed electronically. So if you give us a different name that doesn't match exactly what's on your insurance card, that claim may not process correctly and you may get a bill that you shouldn't receive. We don't want that to happen. So that's important. Your name, as it's listed on your insurance card, your address, phone number, if you have a house phone and a cell phone. We'd like to gather all that information. Any contact information you'd like us to have. It could be your emergency contact, or maybe it's your spouse or another family member, or maybe even a neighbor. We always like to have at least a second way of reaching out to you if we can't get through to you on your first number. If you have an email address, we'd like to take that down. We do have a patient portal that you can send us messages on and receive your test results and different things. So you can communicate through the patient portal. So if we have your email address from the very beginning, we can send you an invitation to join our patient portal. Once again, your insurance card details are very important. There will be different phone numbers on there that will help us, and different information on there, your plan number, each one's a little bit different. But we have a whole team of people that that not only verify that your insurance is in effect, but also that you're allowed to come to Ironwood Cancer and Research Centers, and that the insurance company will pay a portion of it. They also look at if you have a copay or a co-insurance or a deductible. They gather all that information before your first appointment. We'd also like to know the names of your other physicians. Your primary care physician is always important. Also, any other specialists you may be seeing. That way the physicians can speak to each other and coordinate your care. Last, but most importantly, do you know the reason why you're seeing a hematologist or an oncologist? All of this information will be gathered over the phone as you schedule your first appointment with Ironwood. When you're preparing for your first appointment, after you've made the appointment, now you're preparing for it. Of course, there's paperwork that needs to be filled out. Now it can be done electronically. If you have an email address, we can email it to you. You can complete that online and email it back to us. Also, we can print it out and mail it to you. Or it's on our website at www.ironwoodcrc.com. You can print that new patient packet of paperwork out for yourself and hand carry it in. So there are quite a few options for filling out all the needed information. If you choose to come into the office to fill out your paperwork, please arrive 30 minutes early. That gives you enough time to fill out all the necessary paperwork. So when you come in for your first appointment, before the appointment, the medical assistant may call you and might ask about any previous testing you may have done, whether it's a mammogram or a CAT scan or lab work. So someone may call you asking about a few more details before your appointment. Our front office will call you to remind you of your upcoming appointment, probably the day before, may even be 2 days before, just as a reminder that you do have an appointment with us. Also, our benefits coordinators may also call you to inform you if your insurance has a copay or a co-insurance that's due at the time of your appointment. This is a nice reminder because you won't be surprised when you come in for your appointment if we are asking you for a copay of $30, for example. So they'll call you ahead of time to let you know what we found out when we researched the insurance. When you actually come into the office for your first appointment, the reception will make a copy of your identification card. It could be your driver's license or a military ID, whatever type of identification card you have, as well as your insurance cards. So you may have 2 insurances and you may have a prescription insurance. So we'd like to take a copy of all of those. So whatever comes up, we're prepared and we have all your information. The reception will also ask you to pay any copay or co-insurance that might be due, and you will have already received a phone call from our benefits coordinators if there's something that may be due when you come in. So once all the paperwork's gathered by reception and they've copied your cards, then the medical assistant will greet you and take you back to an exam room. They'll take your vital statistics and they'll review all your history with that's already been entered by the new patient schedulers, but they'll review it with you before you see the physician. Something may have changed or something may have been missed between the time that you scheduled the appointment and you actually came in to see the physician. Now you're ready.
All right, thank you so much, Terri, for all of that information. We do have 2 questions here. The first one is, do I need to bring records with me at the time of my first appointment?
Yes, if we have not received the records from, say it's your primary care office, or if it's your another specialist office. A lot of times they send over the records with the referral, but sometimes they don't. So that's always a good question to ask when you're speaking to someone. Are there any records that you still need? If you were inpatient in the hospital, we have access to gather those records from the hospital. So we will already have all the hospital records. Thank you.
Okay, the next question is, what type of insurance do you accept? What insurance do you not accept that you know of?
That would be a good question for our benefits coordinators. We see most all insurances, but there are limitations, and each insurance company has layers and layers of different plans within that insurance company. So it's not always cut and dry. It's really a good a question when you speak to a new patient scheduler and they work with the benefits coordinator. And once we have all the details from your insurance card, we'll be able to let you know for sure if it's if it's within the network for your insurance.
Okay, and lastly, how do I know what physician to schedule with for my new patient appointment?
In most cases, if a referral comes from your specialist or family practitioner, they normally have a physician that they're comfortable with and will recommend a certain one. If you're coming from a hospital, you've been inpatient in the hospital, it normally would be the physician that was called for the consultation and saw you face-to-face in the hospital. However, you are welcome to see anyone in the practice that is more convenient. We have locations all across the greater Phoenix area that, you know, if you live closer to one particular location than another, then we can find, you know, which is most convenient. If you prefer a male or female, we can also accommodate that. Hope that helps.
Great, thank you so much, Terri. We appreciate all of the information today that you've provided for us. I want to thank you for those who have joined us today. Please join us next Tuesday at 10 a.m. for our presentation, or for our keynote nurse, Christy's presentation on misconception of chemotherapy. Thank you so much and take care.